We are planning to discuss another problem of the intestines, and that is constipation. Now, I know diarrhea is very common in Pakistan, but children often get constipation, and parents want to know what it is and how to manage it, and of course, why it happens. So, let me begin by explaining what we call constipation. It is basically the passage of hard, painful, uncomfortable, and infrequent stools. Now, different authorities define it differently, but generally there is agreement that if a child passes difficult stools, hard stools, and if they are only 3 times a week, then it could be constipation. Of course, you have to understand that after a baby is born, as I've explained earlier, they get 1 to 2 stools every day, and then after the 15 days of life, or in the first few months of life, maybe 1 stool every other day, especially if they're breastfed. But as long as they're not hard, painful, and difficult, this is not constipation. So when does this occur? Meaning, what ages do we see? First, of course, we see it when solid foods are introduced, so around 6 months or beyond. And that has to do with the kind of foods that are given. So if you do not give enough fiber, fruits and vegetables, and do not give enough water, then the baby can become constipated. The second time is usually when you try and toilet train them. So there is a pressure on the parents and pressure on the child, and this sometimes becomes a tussle, and the baby may not want, and the child may not want to go to the toilet, and so he holds stools and it becomes hard. And the third time is at school, when they may have other issues. They may not want to go to the public toilet, they may be embarrassed to get permission to go there. So what are the symptoms? What does the child complain of? Of course, I've said they may get hard stools, but abdominal pain is very frequent, and if it's very severe, the abdomen may be distended. There may be sometimes belching, sometimes discomfort, and sometimes if it gets aggravated, then the child may not want to eat as well. So when you go to your doctor and explain this to him, and sometimes the symptoms are only pain in the abdomen, the doctor will want to know when it started, and whether it started right after birth or whether it started later on. They will also want to know the diet pattern, how much milk and what kind of milk the child takes, and what is the ratio between the milk and the solid foods and the kind of solid foods he takes. Now, what happens is that if you give a lot of milk, and milk is by and large, other than breastfeeding, and especially cow's milk or buffalo's milk has a tendency to cause constipation. And if a child drinks a lot of milk and doesn't take enough solids, there is a greater chance of developing constipation. Similarly, if he takes food but takes only junk food, for example, foods with cheese and fats, and he can also get constipated, or soft drinks, or for example tea or coffee, or cold drinks. So the balance between the milk and the solids, and the kind of solids, the solids should have a lot more fiber, and fibrous foods are, for example, cereals, whole grain wheat, and you should include a lot of fruits and vegetables and a lot of water. The child should also be encouraged to exercise, because that aids in digestion, and just not sit there. So imbalance in the diet is a very common problem. Now, after examination, and sometimes when the doctor checks the child, he may want to do what we call a rectal examination, and then there might be a few tests like an X-ray or so. And if the reason for the constipation is not the imbalance in his diet, but it is to do with internal problems, like something that the child was born with, or a hormonal imbalance, then the child may be subjected to some tests. There may be X-rays of the rectum, and there may be a biopsy in some very rare instances, and there may be some blood tests. So the management is the same. You need to change the diet, you need to encourage intake of water, encourage exercise, and you want to encourage the use of foods that contain fiber, more fruits, more vegetables, and in some instances juices. For example, apple juice is a good example, and juices. So the diet balance or mix is what is most important and most relative. In addition, your doctor may want to give some stool softeners. He may give you some medicated fiber, as we call it, or he may give sometimes stimulants for the intestines to evacuate, and very rarely enemas or suppositories may be needed. So the earlier you check this, the better a child's nutrition habits are, the less the chance of constipation and the less the chance that we'll have to resort to tests or to give strong medicines.